We have to exercise certain habits and certain behaviors that is conducive to having good health. So we pray, Lord, as we have this discussion and Dr. Andrews present this, that your spirit would lead them so the things that will be said will be to your honor and glory, and that we could glorify you through our body temples. We ask these things in the name of Jesus. Amen.
Amen.
So let me introduce you to those that we have on here. We have 10 people on there. I just want to welcome everyone as we going to discuss his health. Uh, Dr. Raymond Andrews is going to be our presenter. He was born in Washington, D.C. to parents, Newton and Lydia Andrews, who were and still are dedicated to service professions. Early in his life, he also felt the call to serve, which led him to choose a career in medical field. After completing his BS degree in biology at Oakwood University, Dr. Andrews attended Loma Linda University, School of Medicine in Loma Linda, California. Since that time, he has used his skill to help others. As a medical student, he traveled to Mexico, Malamulo Hospital in Malawi to perform medical mission work. After graduation, Dr. Andrews returned to Huntsville, Alabama to complete his residency in family medicine at UAB School of Medicine, Huntsville campus, and successfully completed the program in 2004. Now he is owner and president of Andrew Medical Care in Huntsville, Alabama. Dr. Andrews is board certified family physician and member of the American Association of Family Practice. Dr. Andrews has two hospital affiliations, one with Crestwood Medical Center and the other with Huntsville Hospital. In addition to his private practice, he is the medical director for the Morgan County Correctional Facility and medical director for Encompass Hospice, which, by the way, my mother is receiving some services from that particular institution as well. Dr. Andrews enjoys empowering others through health education. He has appeared on several local news broadcasts for featured
Mhm.
health reports and interviews, and is a guest lecturer at Oakwood University as well as several local community events and churches. From the inception of his medical career, Dr. Andrews has used his skill to do medical missionary work and most recently traveled to Haiti post-earthquake 2010. In addition to his public service, Dr. Andrews is also involved in ministry of his local church as a praise team vocalist. We're not going to ask you to sing today unless you feel that that's going to help our health in some way. Dr. Andrews is blessed to have an amazing wife, Yin, and three handsome sons, Mahari, Micah, and Micaiah. I hope I pronounced them correctly.
Makai. That's not.
Micaiah, with whom he enjoys spending time. He is also an avid basketball and football fan and enjoys traveling, cooking, listening to music of all genres. Dr. Andrews desires to live a well-rounded, well-balanced life as he strives to be a faithful steward of the gifts that God has given him. Dr. Andrews, we want to thank you for spending your time to bless us with the gifts that God has given you. Um, and if you're ready, we're going to let you go ahead and take over. We're not going to ask you what basketball team or football team you root for. We don't want you to get in trouble. So go
Yeah.
ahead. We're going to leave that part out.
All right. Well, thank you for inviting me. It's a pleasure to be here. And just look forward to, it's always an honor to talk with men, to educate. It's rare that you get men actually interested in their health or to speak up about what their health challenges may be. So this is an opportunity to educate and hopefully for people who hear this information to change the legacy in their family. There's a lot of misinformation or a lack of information, and you could literally save your family and those who come behind you just by doing simple things and being vulnerable enough to care. about yourself and those around you. So
Dr. Andrews,
we're
before you go any further, let me just say that to everyone on the panel here, that go ahead and mute and reserve your questions until the end. Let's let Dr. Andrews go ahead and finish what he is going to say, and he will entertain questions at the end of his discussion. Thank you.
all right. Thank you. So we'll go to our first slide here. Basically, I'm talking about in the terms of men's health. Why we have trouble engaging in the health system, why we have trouble doing routine checkups, routine follow-ups, going to the dentist, going to the doctor, our primary care doctor, if we even have one. So we're going to talk about some of the reasons why men in general don't go to the doctor, um, and try to find out what is our hang up, where are we meeting a roadblock, what's our challenge, and what's unique to each man, why he is not engaging in his health care. So I've had some reasons here why men in general don't go to the doctor. Number one, they don't have one. They, you know, I know for me, my wife does a lot of things for me, arranging appointments or setting up, different things for the kids. And very rarely do you, she has her doctor, the kids have their doctor, but you don't have your own. So taking the time to say, you know what, somebody get me a doctor, or asking around to friends who may have one or coworkers, where can I find a good doctor, a primary care doctor? Number two, don't have insurance. Jobs may not offer it, may be too expensive, or you may not be aware that your job offers it. There's probably nothing wrong with me. I feel fine, so why am I going to go looking for trouble? I don't have time. I'm very busy. Got a lot to do. Um, to take time off work or to take away from something else I want to do is going to be difficult. So I'm not gonna press it. I don't want to spend the money. Uh, and then doctors don't do anything. When I go, he just talks to me, asks me some questions, and then sends me out the door. So what am I really doing there? Other reasons, I don't want to hear what I might be told. So ignorance is bliss. I don't want to hear if I'm feeling good, the fact that something else might be going on, I don't want to disturb anything. So I'm not going to go. I've got probophobia. So he's going to push on me. He's going to look in my ears, my mouth. He's going to ask me about checking my prostate. I'm not going to do any of that. So I'm just going to avoid the whole situation. I'd rather tough it out. So if something is wrong, if I've got pain somewhere, I'm a man, I'm not going to complain. I'm just going to get through it. It eventually will go away, or I'll try to pray it away. And then lastly, my significant other has been nagging me. So sometimes the wife or a spouse is telling them to go. So I'm not going to go just because you're telling me to go. I'm not going to do what you want me to do. So sometimes it can be a bit of stubbornness of why men don't go to the doctor. So let's look at some reasons why Black men don't go to the doctor. There are some things unique to men of color of to why they don't engage into the health system. Mistrust. So mistrust of the medical system. We do have a history, a legacy in this country of the Tuskegee experiment. Everyone knows that it was not that long ago. So there are some barriers that are real that stop men of color from engaging in healthcare. Find it to be an unpleasant experience. If I go, someone's going to talk down to me. Someone's going to mistreat me or not treat me as a human. Most times when you go into a medical setting, the person will be white or not a Black person or person of color. So there is a well-known prejudice that exists sometimes in regards to Black people may not need as much pain medicine, or they don't hurt the same way others do. So the care may not be the same, but that's not a reason to stay away. Okay. Next, information offered is not practical. So when information is coming from say, a Caucasian doctor to a person of color, they may be speaking in terms that a person of color may not even understand, or they may be talking about dietary changes or dietary recommendations that a person of color can't identify with. So there's information given that's not practical. If a person of color may not be of means and they can't afford a gym membership, you might have a health professional telling them you need to get a gym membership, you need to work out. That's not practical for them. They may need to do exercises at home. So some of these things do cause a bit of a reluctance to engage. The next reason, lack of resources and support to help men adhere to medical regimens. So if I do go to the doctor, that doctor may ask me to get an x-ray. I can't afford to pay the copay for the x-ray. The doctor might ask me to get a prescription. I can't afford to get my prescription. So a lack of resources can cause people to stay away. Why would I go if I can't afford what he's going to tell me to do? And last two here, it's hard to make lifestyle changes due to their other responsibilities to family and community. Lifestyle changes here basically means if I need to start exercising, I have to take time away from my job or from my church responsibilities or other things that I really feel passionate about. And you do have to pull away and be a bit selfish in order to care for your health. So if someone finds it hard to disengage from their community in order to take care of themselves, they can feel a little guilty about that. So that is a barrier for some men. And then lastly, financial. We spoke a little bit about that before. Can I afford to see the doctor? Can I afford my copay? Can I afford my prescriptions? Can I afford to do the things he's asking me to do, physical therapy? So there are some barriers that men of color experience that others may not. So where do we stand? As African American men, Black men, or men of color, where do we stand when it comes to the diseases that are out there? Where do we stand when it comes in terms of heart disease, cancer? So we're going to go through some of those things to kind of understand why we need to engage, because we are not doing as well as we feel. I'll put it that way. And here, this is just the facts. Where do we stand in regards to heart disease? Nearly half of all African American men have some form of cardiovascular disease. Okay, nearly half have some form. That could be in the form of hypertension, high cholesterol, mini strokes, stroke. All those are considered cardiovascular disease. So out of the people on this call, half of them have some form of cardiovascular disease. Next, cardiovascular disease is the leading cause of death among African American men. Everybody is worried about cancer. You hear prostate cancer, you hear colon cancer, you hear people screaming from the hilltops, cancer, cancer, cancer. But don't forget about heart disease. Cancer is still significant, but heart disease is the leading cause of death. African American men are more prone to heart disease, and they are also twice as likely to die prematurely as a result. So we're more prone and twice as likely to die prematurely, okay? Between the ages of 45 and 64, Black men have a 70% higher risk of developing heart failure than white men and women. That's significant. 70% higher risk of developing heart failure than white men and white women. What's going on? We're not doing too well. Secondly, with cancer, African American men have the highest cancer death rate of any racial or ethnic group in the United States. The highest cancer death rate. Part of that is that we show up too late. We don't find cancer early, and by the time we don't get screened, we show up late when the cancer has already taken over our body, and there's nothing to do about it. So the missed step is the prevention and screening. And we'll talk a little bit later about that. But I just wanted to make that connection early as we go through. Prevention and screening can eliminate a lot of these things. Prostate cancer is the most common cancer affecting African American men, followed by lung cancer and colorectal cancer. So, yes, prostate is still the most common. African American men are 2 times as likely to die from prostate and colon cancer. So that's double. And keep in mind, we're only 12% of the population. So for us to be suffering more is that's pretty significant numbers. Um, the rates of prostate cancer and related deaths in African American men are among the highest in the world. So now, if you're branching out to the whole world, African American men are leading the world in prostate cancer and related deaths. Okay. African American men are more likely to be first diagnosed with advanced stage cancer. Okay. And a half have no primary care provider. So there again is that connection. Don't have a doctor, they're not being screened, they start to feel sick, and by the time they show up, it's in a bad place. Whereas if you're getting checked out early, you can find things early in screening, get rid of them, and you can live a productive life and not become a statistic. Diabetes, okay? About 2.7 million African Americans have diabetes. It's in this country, and at least 1/3 of them don't even know it. So about 30% of them don't even know it. So you got about 1 million people running around not knowing that they're diabetics. African Americans are 80% more likely to be diagnosed with diabetes. All right. So this is a disease that our community is just not making any progress on. We're getting worse and worse. And the majority of the problem is our diet and inactivity. Diabetes, type 2 diabetes is what this is mostly talking about, which is preventable. So we're suffering from preventable disease. We're dying from preventable disease. I want that to sink in. African Americans are also significantly more likely to suffer from blindness, kidney disease, and amputations because of the condition. So that's just basically saying that when we do have diabetes, we are the ones who are suffering more of the complications. If you notice in Northwest Alabama, Huntsville, you see all these renal dialysis clinics on the parkway. They're scattered all through Northwest Huntsville, which is majority minority community. And that's because we are the ones who are losing our kidneys to hypertension and diabetes. So we are suffering the complications of diabetes more proportionately more than the other races. African Americans today have a 50% chance of developing type 2 diabetes in their lifetime. So that's basically saying half of the people on this call, if you're African Americans, I'm assuming are all African American, half of us are going to develop diabetes during our lifetime. That's pretty startling. That's pretty startling. So we've got to start thinking and doing something different. We've got to do something better. Where do we stand with obesity? 40% of African men are obese and 70% are overweight. Obesity-related conditions are the second leading cause of preventable deaths. And many African American men live with this risk factor their whole lives. Now, what is obesity? Obesity is being overweight, and it does lead to other diseases such as hypertension, diabetes, heart failure, heart disease. So obesity is the gateway to a lot of these conditions. Obesity contributes to health conditions that disproportionately affect African Americans. And again, diabetes, heart disease, stroke, and also cancer. Obesity is a risk factor for cancer. So being overweight can increase your risk of cancer. So that's the real thing that we have to fight in our community is our obesity. And because it is a gateway to these other conditions. And we're not doing a good job right now. Part of it is culture, where we've grown up eating a certain way. and we just can't change it. No, this is what I know. This is how mama did it. So this is what I know to be good. Well, it might be good, but it's not healthy. And the big deal is, what is more healthy? So it takes education. It takes maybe seeing a nutritionist to say, look, this is what you're doing. Let's change some things. And it's not huge changes, but let's change some things to make your diet more healthy. Let's get active. Try to lose some weight, because as we can see, losing weight can make us more healthy all around. Why are we so different? What makes us different as African American men? One overarching factor contributing to the disparity is that minority men are less likely to get both preventative care and to have access to quality health care when they get sick. So, you don't have a doctor, you don't have insurance, or you're less likely to have insurance. So, you're not going to go get preventative care. An urgent care clinic is not a place to get your preventative care. So some people think, well, I go to a walk-in clinic. They're not interested in your preventative care. They're not sending you for colonoscopies or prostate cancer screenings or lung cancer screenings. They're there to patch you up and send you on your way. Um, and then access to quality health care. If you notice, in a lot of our minority neighborhoods, there aren't doctor's offices. Like, where are the doctor's offices here in Huntsville are in Madison and South Huntsville. You would be hard pressed to find something, unless it's an urgent care clinic in Northwest, and there's not many there either. And that's intentional. Um, there's no quality health care in our communities of color. So when patients do get sick, they're not going to get the care they need. So you have to be an advocate for your own care and seek out quality health care. Seek out where you can get preventative care. So what are we suffering? What's the cost that Black men are facing due to a lack of engagement into the healthcare system? Number one, African American men die 7 years earlier than white men. 7 years earlier. What can you do with 7 more years added onto your life? I want everybody to think about that. 7 years for me, my kids are in high school. I would miss them going through college. I would miss them going to graduate school, getting married. I might even miss my first couple of grandkids. 7 years can be significant. So I want you to really think about that. If you are not engaging in your health, you are cutting off years of your life with your family and those that you love. Don't even do it for yourself. Do it for them. Do it for the grandkids that you may never meet. African American men suffer more and die earlier from chronic diseases. So, like I said before, diabetes affects us more, hypertension affects us more, and it's cutting our lifespan short. African American men die mostly preventable diseases at a higher rate. So, if something is preventable, I mean, I would do everything I could to avoid um, succumbing to it. And these are diseases that we're talking about are things that we eat ourselves into, or things that we just fail to detect. And by dealing with them early, we can prolong our lives. We can have healthy, productive lives. I just put up a slide here about the leading causes of death. And this is for Black males in the United States. This was done in 2014. So as you can see, heart disease is the leading cause of death for African American males. The asterisk there means that the significant amount of these problems are preventable. If you see that at the bottom of the screen. So the leading causes of death, the top 4, heart disease, cancer, unintentional injuries, and stroke. The top 4 causes are all mostly preventable. So we are dying from preventable reasons. So we like to blame the white man for everything that they're doing to us. He's doing this. He's got me down. He's putting his foot on my neck. But we're doing this to ourselves. We're doing this to ourselves. So these are preventable. Um, so I just want that to sink in, that there are things that we can address and deal with early. Hypertension doesn't have to turn into a stroke. It doesn't have to turn into heart failure. We just have to deal with it early, get the treatment we need, do the things that we can do to try and reverse it. If we can't reverse it, then we stay on our treatment and manage it. But if we don't, that's when it turns into the stroke or the heart attack. So engaging early and screening can prevent a lot of these complications. Look at diabetes, number six. It's the number six leading cause of death for Black males. It's 90% preventable. That's amazing to me. And I wish people knew that, because most people who show up and are diagnosed with diabetes in my office had no clue. They usually show up when they're urinating out of control, they're losing weight, they can't understand why. They've never been to the doctor before. This is the first time they're coming in because they're feeling so bad. And if they had come in 10 years earlier, we could have seen, hey, your blood sugar is going up a little bit. Let's start watching that. Let's start doing some things differently. And at that point, we could have prevented where we are now. So 90% preventable. Okay. So I just want to get that to sink in for you guys. So becoming a better steward of your health can help prevent disease. All right. How do I become a better steward of my health? Number one, find a healthcare provider. How do I do that? Ask your friends, ask your family. I ask every new patient who comes in my office, how did you hear about us? And most times it's from somebody I asked, they told me about you guys, or I looked on my insurance website and they told me, um, hey, these doctors are in your area, they take your insurance, here are their ratings. So they even have that on your insurance website. What I'm finding out, a lot of people are being referred to me now through, there's an African American Facebook page. They're looking for um, people who do different services who are African American. And I've gotten a lot of patients who said, hey, I heard about you on this site. So start asking around, paying attention. Information is out there now, so you don't have to guess or wonder about where you can go. You can actually speak to people who have actually experienced that provider. And when I say provider, that means doctor. Meet with your provider, your doctor, to assess your lifestyle, family history, your disease risks, and your cancer risks. So I put that in there to say you need to be assessed because everyone is different. Everyone has their own family history. I hear people say, well, nobody in my family has cancer. Well, how do you know that? Were they actually checked? Were they screened? My mom was the first one in her family to have breast cancer. That's what we're saying, but we don't know that. But she has it, and because she got screened, we were able to find it and treat it. But sometimes just saying, well, this is not in my family is not enough. You still should be screened regularly. Actively engaging in preventative care, so diet, exercise, health screenings. Understand that many preventable diseases must be screened for because they may not show any symptoms until the late stages. So the hypertension, the diabetes, they call hypertension the silent killer, and they call diabetes the great debilitator. Those things can smolder and be under the surface for so long. And it's not until you actually go get your blood pressure checked that you can actually realize, something's wrong here. So I wish high blood pressure would hurt at the early stages so people would actually come in and say, something's wrong with me. But you can go for years with high blood pressure and not show up until it has killed your kidneys or caused heart failure or you have a stroke. So it's very, very important to be screened or you'll never know. And then lastly, follow through. I've had guys come in my office, they're seen, hey man, you're diabetic. we've got to do something about this. All right, I'll be back. I'll be back. Yeah, I'm gonna exercise. I'm gonna do everything. You never see them again. Follow through, guys. Close the loop. Follow through. Follow through. It's for your own good, and you're not doing yourself any favors by disengaging at that point and saying out of sight, out of mind. It doesn't work that way. So we're asking that you follow through. Specifically, I'm going to just list a few things that you can do, like for heart disease screening. Have your blood pressure checked at least once a year. Okay, at least once a year. There are numbers that you're looking for that your doctor will know, hey, this is elevated. This is in a pre-hypertensive stage, or it actually is hypertension. So you want to know about that. You want to know where you are. Your cholesterol should be checked at least every 5 years. Okay. If you have high cholesterol, diabetes, or heart disease, or kidney problems, you might need to be checked more frequently than every 5 years. So if you have nothing going on, you would need at least every 5 years. If you have other diseases going on, then you probably should have it checked more often. Colorectal cancer screening. So this is colon cancer screening. If you're under age 50, you should talk to your healthcare provider about getting screened. It might be your time to do that. It's based on your family history, how early you need to start having colon cancer screening. If you're African American, they actually recommend now to start screening at age 45. Okay, so African Americans, age 45, everyone else, age 50. But if you have a strong family history, they might screen you earlier than 45. So you have to talk to your doctor and see which interval is right for you. There are different ways they can screen for colon cancer. The colonoscopy is the best way to screen, but if someone feels that they are squeamish about that, there are some other ways to check that don't involve a procedure. It just depends on your symptoms and what the doctor feels your risk is, okay? But go and find out what is best for you. Eye exam. Eye exam is something that you should be doing at least every 2 to 4 years based on your age, 40 to 54, and then every 1 to 3 years if you're 55 to 64. Your provider might recommend more frequent eye exams if they start to see your eye pressure going up, which is the main problem in glaucoma. Okay, so they might think you have pre-glaucoma changes in your eyes. They're going to look at you more frequently. And then if you have diabetes, you need to have an eye exam every year. Physical exam. What is a physical exam? That's an exam that a healthcare provider will do that looks at your blood pressure, looks at your weight, looks at your height. It's a screening for depression. Doctor will talk to you about diet and exercise, alcohol, tobacco use, and other factors that can negatively impact your health. So a physical exam is what you probably want to ask for if you don't have any problems, you don't have high blood pressure, you don't have anything like that, you want to ask your provider, hey, can I have a physical exam? And that's where they will look over you from head to toe. And if they say, I don't do those, then you need to find a new provider. Find somebody who can do a physical exam on you, okay? And then prostate cancer screening. If you are at average risk for prostate cancer, they start screening about age 50. For African American men, they start screening earlier. So if you notice the two diseases they start screening earlier, prostate cancer, colon cancer, because it affects us earlier, and we tend to have more severe forms of those things when they are found. If you have a first-degree relative, like a father, brother, or son, diagnosed with prostate cancer earlier than 65, you need to be screened at age 45. Now, if you have more than one first degree relative who had prostate cancer at an early age, they might even screen you a little bit earlier. Okay, so age 40. So it's important to go in and find out where you are. And then it's important to talk to your family. Hey, next family reunion or Thanksgiving, start talking to the men and the women. Find out, hey, what's in our family? What's going on? What do people know they have? What, because sometimes people are very secretive or quiet about their issues, and we can't help each other with secrecy. If I know what I'm at risk for, then I can get screened and get the help I need beforehand. This slide, a little graphic, but I put it up here because this is what everyone's afraid of, the prostate exam. Why does he have to go in there? Why does he have to check in there? What's going on? What is he doing? You know, I think he's just playing around back there. No, the doctor is actually doing something meaningful. He is able to check, if I can see my cursor here, your prostate gland has 3 parts here. And he is able to check your prostate, but you can only do it through the rectum. There's no other way to do it. And to get a feel of if there is hardness, if there are bumps, the texture of it, um, and the size. And some of those can be indications to whether you need a referral onto a urologist to do more in-depth testing. So this is what the prostate exam is doing. And there's a blood test, but this is also the rectal exam. And both can go together to help determine your prostate health. Okay, just thought I'd put that in there. Lung cancer screening for those who have smoked significantly. If you have a 30-pack year smoking history and you have quit within the past 15 years, they do recommend lung cancer screening if you're over 55. Okay, so ask your doctor, do I qualify for lung cancer screening? That is something that's newer on the horizon that they've been doing. They weren't able to do this before. And then diabetes screening. If you're 45 or older and you're perfectly healthy, you should be checked at least every 3 years for diabetes. But if you're overweight, you probably are going to be screened at an early age and screened more consistently. So testing more consistently means they might test you at least once a year when you have your physical to see where your blood sugar is. Some conditions, or I should say risk factors for people who should consider testing more frequently are if you have a family history of diabetes, you're overweight, you are not active, if you are African American or Hispanic, Native American, those ethnic groups just have a propensity to diabetes, even Asians and Pacific Islanders. If you have previously had an elevated blood sugar, if you have hypertension, or if you have any cholesterol abnormalities, you should probably be checked yearly for diabetes. It tends to run together with hypertension and high cholesterol. So that's why if you find one, you have to start looking for the other. Okay. All right, so that kind of ends our screening talk. Going to transition a bit to, since this is a church event, we have to look at what Jesus is saying to us. What is he saying about us, our health? And I've heard some people say, you know, I'm not gonna claim that I have hypertension, or I'm not gonna claim diabetes, and maybe magically somehow they feel it will go away. And there's nothing that God has ever asked us to do that he doesn't involve us in. He seeks to involve us in everything that we do. It's God and man working together. The only thing he does on his own is salvation. And God seeks to involve us in maintaining our health and the healing process. But we are going to have to do something in addition to having faith. And faith without works is dead. We all believe that, right? So you have to do something along with your faith. You just can't believe, I'm going to pray my diabetes away and it will go away. No, you have to put down the donut. You have to exercise. You have to put the soda down. You're going to have to do something different to show that you believe, Your works are going along with your faith. Um, I hear patients talk about also that, you know, it's gonna, I've claimed that I received that it's gone. God is taking it away. Well, miracles do happen, but they are very rare. Okay. And it's in the Bible when people had miracles done, they followed up to confirm their healing. So if you feel that you're free of whatever ailment that you've been diagnosed with, then still follow up with your doctor and confirm it. Follow up, close the loop, confirm that you are better. The 10 lepers, when they were healed, Jesus told them, go show yourselves to the priest, because that's where the testimony comes, is when other people see that you are healed, then yes, it is confirmed, but it still has to be confirmed. So my point is, if you feel that God has healed you from whatever ailment that you were diagnosed with, don't be afraid to follow up. Don't stay away from the doctors forevermore. Follow up, confirm your healing. Okay. We also have to be willing to want to be well and then take the action. I provided several examples here where in the Bible where Jesus asked the man at the pool, do you want to be well? Jesus told him, take up his mat and walk. So there's an action there. He just didn't ask him if he wanted to be well. He also gave him an action to follow through to do. Woman with the issue of blood, she believed, but she had to touch. Okay. The man who was born blind, Jesus spit, made clay on his eyes, then told him to go wash. Um, the Naaman had faith, but he had to go dip in the river. So all these scenarios involve faith or belief, but they also involve action. What I'm positing to you today is that your action is following up on your health, engaging with the medical doctor, engaging with the health system, doing the changes that it takes to change your diagnosis or to treat your diagnosis. So don't just pray about it. I'm asking our Christian community, do something about it as well. It doesn't mean you don't have faith if you take your medication. It doesn't mean you don't have faith if you start to exercise. It doesn't mean you don't have faith if you change the way you eat. Don't just say, don't do one without the other. They go hand in hand. Um, and I have these conversations. I guess I'm harping on this a little bit because I have these conversations with my Christian patients all the time. And some feel that it's a lack of faith that they got sick. And we're born in sin. We're shaped in iniquity. There's nothing you can do about that. In this world, we will have trouble. We're promised that. But our overcoming is in Jesus, and He's given us ways to do that. So let us not feel down or depressed that we may have diagnoses or conditions. Let's attack them with Christ, with faith, but also with action. And what does Ellen White say? What does she say about our stewardship for our own health? And I'm just going to read this one area in blue here. It says, should the Lord work a miracle to restore the wonderful fine machinery which human beings, through their own carelessness and inattention and their indulgence of appetite and passions, have destroyed in doing the very things that the Lord has told them that they should not do? So, in other words, Lord has told you not to do these things. You do them anyway. Should He still heal you? And she goes on to say that should He heal people who just continue to do things to hurt their body, He would be administering unto sin, which is the transgression of His own law. That's deep to me. So we are negating our blessing of health when we do the things to our body that Christ has not intended for us to do. So it says here, the key word she used was carelessness and inattention. And I point that to engaging ourselves in the healthcare system, not paying attention to health screenings, not having your own doctor, not knowing the status of your health. Where is my cholesterol? Where is my blood sugar? Where's my blood pressure? We have to pay attention. We cannot be careless. We cannot be inattentive. when God has given us our health. We have to be better stewards of our health. Because what she's saying here is if we don't pay attention to it, God is not going to take us out of it, because we've done it to ourselves. It's what we've wanted to do. Okay. So that's a word for somebody today. Paul, we know Paul, he talks about our bodies being the temple of the Holy Spirit, which we've received from God. Our bodies are not our own. We're bought with a price. Therefore, honor God with your bodies. 1 Corinthians 6:19 and 20. He also talks about our body as a sacred place, the place of the Holy Spirit. And whatever you eat or drink, do it all for the glory of God. So we have to be willing to make some changes in order to honor our temples. Some of the things we've grown up doing, once we know better, we've got to change it. Once we know, once we learn what is more healthy for our body, we have to change it. You know, in our Adventist circle, you know, some people pride themselves on being vegetarian, but their diet is not balanced. They may overdo it on sugar or carbohydrates. It just because you're vegetarian doesn't make you healthy. Just because you eat vegetarian meat doesn't make you healthy, because that's processed food as well. God is calling us to move into more and more truth. And as we find that truth, we have to do better as we're doing it to the glory of God. So lastly, I'm just put up this slide here just to reinforce to men. And it says, running away from your problems does not count as exercise. And that's as men, sometimes we like to do. We do not like to confront obstacles. We don't want to confront any issues in our lives that are going on. But our health is something we have to confront. And we might be in better health than we think. But when we find that there are things we need to work on, we have to confront them. We have to deal with them. And Christ will give us the help we need, or the faith we need, and the fortitude to follow through and address the conditions that are preventable and treatable. So I just want to encourage everyone, get engaged, stay engaged, follow through. And the manly thing to do is confront your issues. Your family will thank you for it. Your wife will thank you for it. Your children will thank you for it. And those behind you will benefit from you being a good steward of your health. That's all the slides I have, moderator. So this time, if anyone has questions, they can definitely tap in and we can see what men have to talk about.
Okay. We have some comments and some questions in the chat. So I'm going to go ahead
Sure.
and read. And
Okay.
when we come across a question, we'll deal with it. There was a question. I will start. Oh, never mind that. Okay. Let's see. I have to scroll down. Okay, Dr. Andrews, African American men with Caribbean men, the highest morbidity and mortality rate for prostate cancer in the world. This is the comment that they're making. While African men on the continent of Africa have among the lowest rate in the world, what, in your opinion, is a primary reason or reasons for the difference in the aforementioned rates when comparing both groups with both groups when both groups are Black?
Okay, that's a very good question. And the primary issue is diet, the Western diet, what we call the Western diet, the American diet is wreaking havoc on our community. In Africa, they don't eat like we do here in the United States. And it's interesting, even for Asians, there are some cancers that they don't have in their country, but when Asians come to America, they tend to suffer a lot from stomach cancer because of the Western diet. You will see also, there's a graph that I've looked at before. As Black men have migrated They showed the Caribbean, I guess where the slaves were deposited, when they looked through that timeline of different countries where there are a lot of Africans who have been um, spread out across the country, as the diets become more westernized, you see the rates of cancer start to rise. Okay. So the primary reason that we have the rates of prostate cancer that we do in this country is the obesity and the diet. So diet is it's killing us. It's killing our community. But that's the number one reason is the Western diet. And particularly in the diet, it's the animal fat and obesity. So when I say animal fat, red meat, fried foods, cheeses, um, yes, cheese, because some vegetarians tend to eat a lot of cheese, but cheese is straight. It's just animal fat. So animal fat, cheese, obesity, red meat. Those are the things that are increasing our cancer rate. Processed foods too. Go ahead.
Are you finished now?
Yes, sir.
Okay. Someone put a comment, I think, under Earl Henry. It says, do women have a role to play in supporting men's health? And if so, what is that role? Don't get in trouble now.
I know he's trying to get. Oh, the only thing I would say if a woman has a role, I guess support. They're not responsible for men's health, but it's always helpful when a woman is supportive. If you want to make dietary changes or you all want to exercise together, that support is important. So I would say support is probably a good thing, but they're not responsible for our health. Let me get that straight. But support is always helpful.
I don't want to make trouble, but there's some survey that says that married men live longer.
That
I
is
don't know.
true.
That might be a little.
That is true. That is true.
All right. So, Dr. Andrews, within recent times, there has been talk in the medical community linking the implication high cholesterol or even pre-cardiovascular disease conditions to erectile dysfunction. Can you speak on that?
Yes. Yeah, your erections are a reflection of your heart health, basically. That's basically it. So if you are, um, as you start to age, 40s, 50s, men usually start to notice some change there if they are not physically fit. And that's because their circulation is not what it should be. Their heart is not efficient. So when they are engaged in sexual activity, their other muscles become a priority as far as getting blood, and the blood doesn't go to the penis, which is where you need it for erections, because the heart is struggling. It's not efficient. So the better conditioning you have cardiovascularly, the better your erections will be. So if you start noticing that problem, the connection could be, medical problems, so hypertension, diabetes, high cholesterol, or you are just in poor cardiovascular health.
All right.
So that connection is there. Yes.
All right. So the accumulation of plaque in your vessels that can happen everywhere and anywhere, and your heart,
Anywhere.
your
Yes.
brain, any part of your body, your legs, everywhere. So,
Everywhere, and especially in the penis, you have small blood vessels. So if you can imagine, if you have a buildup somewhere, it's going to affect the smaller areas the most, first, I should say.
okay.
So definitely that's something you want to get checked.
Now you said earlier that diabetes could be prevented. Someone put a question here. Can diabetes type 2 be reversed?
Um, it's possible, but it depends on how long you have been diabetic and how much pancreas function you have left. I'll explain it this way. Um, when someone is diagnosed as diabetic, their pancreas, which makes insulin, which helps to lower our blood sugar, is usually about 50% gone. It's 50% functional. So at the time of diagnosis, your pancreas is already handicapped. Okay. So as of now, we don't have any medicines to really rejuvenate the pancreas. Uh, but if someone is overweight, losing weight, changing their diet, the rest of the pancreas that they have left can compensate and to work and do what it needs to do if the person makes the changes in their body weight and in the demand and in their intake of sugars and carbs and calories. So that's very important if they make those lifestyle changes.
Yeah.
I say that to say some people can reverse it, not everyone can, because they may have abused their pancreas so much that it's not working at all. And if that's the case, then there's nothing really to continue working. So that person might need insulin. Um, so some people can reverse it, yes, but that is not a reason not to try, because you can also minimize how much medication you need by losing weight and doing the proper diet and exercise regimen that's needed. So yes, some people can be reversed, not everyone.
Okay. So Dr. Andrews, in one of his presentation, renowned social scientist, Dr. David Williams of Harvard University, they mentioned he's Adventist, said that racism is a risk factor for hypertension in Black men.
Hmm.
Racism. So he's inferring that maybe there'd be some, it's a systemic problem.
Hmm. I believe that I do agree with his work. He's done a lot of work on stress and racism and those associated problems. It can be a risk factor. Prolonged stress can lead to hypertension. So I think what he's saying there is the effects of racism can be stressful, and that stress can manifest itself in your health as hypertension. It's not the only reason for hypertension, but um, it is a risk factor that if someone comes in my office with hypertension, I will ask them, what's your social situation? Are you in a stressful situation? Marriage, whatever, job. And sometimes coming out of that situation can help lower blood pressure. So that is true. Yes, sir.
All right. Why have my blood pressure checked once? Why have my blood pressure checked once a year and not just a week or once a month? Why once a year? Why should we check our cholesterol once every 5 years and not once or twice a year?
Well, it depends on your history and your associated health problems. As far as blood pressure goes, um, you can check more often if you want to. That's fine. That's totally fine. But what they've shown through research is that at least having your provider screening it once a year, they're able to catch a significant amount of people who otherwise would not be detected. The other thing is logistics. I mean, many people cannot get to their doctor, or the doctor's not able to see them but once a year. So that can be a factor as well, but it doesn't stop you from checking your own blood pressure. Most people don't have a blood pressure cuff, they don't know how to interpret it. So we do ask, if you see numbers at home that are questionable, definitely get into your doctor to have them check it and screen it accurately. But once a year is what's recommended based on research. Cholesterol, your cholesterol is not going to change drastically if you are healthy and you're following a regimen of diet and exercise. So for those who have no issues and they're healthy and they've been checked before and it looks good, then yearly is probably good. But again, through research, they've shown that checking it more frequently hasn't really led to um, higher detection rates um, and these recommendations are all based on asking those questions. Why not check it every month? Why not have people check it every week? Those intervals were set up specifically because through research, the risk versus benefit shows that these intervals are probably the best times that we can catch the most individuals and not overdo it without getting any more benefit. So keep in mind, cholesterol is every 5 years if nothing is going on. But if you're getting a yearly physical, your doctor probably will check it once a year.
Okay. And Dr. Andrews, we speak about high blood pressure, but do some people suffer also from low blood pressure? And what could be some of the conditions that would cause that?
Very rarely people have low blood pressure. If they have that, it could be point towards an adrenal gland problem or a problem with one of their hormones in the body, thyroid issues. Some people have low blood pressure. You can
Dehydration?
have, yeah, dehydration, heart failure. But those are usually, patients usually feeling bad. That's not something that you would normally run around with and be okay with. You're normally going to have symptoms of that. What's more scary is the hypertension, high blood pressure. Most people feel fine, and
Mhm.
that's the problem, is that it's missed because people don't get it screened because they feel good.
Yeah. Okay. There's a statement here that says, I find it of interest that so many ethnic groups are identified as high risk for diabetes, but white Americans are repeatedly left out. With white consuming large quantities of white bread, white sugar, white whole milk, white flour pastries, white rice. Let me move down here. Uh, okay, so consuming large quantities of white bread, white sugar, white rice, and I'm going in the wrong direction. White milk, white flour, pastries, rice, all types of red meat and scavenger meats, and are regularly overweight. How can they possibly be the model of diabetes management? I don't know about being a model.
That's a, generalization there. That's not the case for Alabama. You look at Alabama, Mississippi, Louisiana, Georgia. The whites in those places are suffering with high rates of diabetes and heart disease. Majority of white people, though, don't live in those areas. So if you look at places like Utah, California, the Northwest, where people, they don't have the diet of the South. They exercise, they're skiing, they're running, um, they're very active. So the majority, white people are proportionally more active than we are. They also have less rates of obesity than we have. So I think your question, with generalizing white folks, is not wholly accurate. It is regional, and so you will find, um, on a whole, if you take white people all together, we're not saying they're the model. We're just saying that the diet in this country does not affect them as it affects us. And it's due to our genetics and our differences in metabolism. Um, when we come towards what we call a Western diet, we don't do so well. So if I'm answering that question correctly, that's what I would say, if I understand it totally.
Okay, there's a statement that says, when we control the things we can, does that put you in a better chance of experience optimal health?
When you
So
control the things you, mhm.
when you control the things you can, does that put you in with a better chance of experiencing optimal health?
Yes, if you control what you know you have, absolutely, knowledge is power. If I know that I have high blood pressure, I'm gonna do everything I can to reverse it. And if I cannot get rid of it, I'm gonna manage it, and that will prevent. I have a great chance of that high blood pressure not causing me heart failure or kidney failure or stroke or heart attack. So yes, knowing what you have is important, and that gives you the knowledge and power to manage it.
So there's another statement, a question here. Isn't it a fact that because Black men don't access the health care system as much as whites, the morbidity and mortality rates are exponentially higher?
Correct. That's absolutely correct. If we don't know what we have, we can't take care of it. And usually we show up in later stages of cancer, in later stages of disease. And by showing up later in the disease, your options for treatment are limited. So usually we are going to suffer more or die faster or have more complications.
So Dr. Andrews, that was the last question and statement in the chat. I
Okay.
don't know if anybody else have any. Okay, wait a minute. Somebody says I have read that prostate cancer is the slowest growing cancer. Someone just came in at the last second and put that in there.
Yeah, it is a slow growing cancer by nature, but in African Americans, we get prostate cancer earlier and we get it, and our prostate cancer tends to be more aggressive. So for everyone else, yes, it's a slow growing cancer. If you look at it, the numbers, most people, men, 70s, 80s, 90s, they get it. They usually will die from something else. But in African Americans, we tend to get prostate cancer earlier. We have more severe stages of the disease, and the disease is more aggressive in African Americans. So that's the difference when it comes to the racial groups as far as prostate cancer goes.
Well, we're going to take one because we're kind of going into overtime.
Okay.
Someone is there a cure for, is that Peyronie's disease?
A cure.
Doug Golden.
That's a good question. There are treatments that they can do to help with that. But I don't know about a cure. There are definitely treatments that they can do to see if they can help alleviate that problem. But you need to have a good urologist working with you to work on that and to see what options are available to you, what's been already done or what can be done.
So we're going to ask people to unmute. Do you have time for any more questions?
I can take a couple more.
Hey, Hammer, I have a question.
Go ahead.
Doctor, I'm thinking of paranoia on the part of, well, even as a Black community, we have been misled and misguided for so long. Why? Who is doing those research, those numbers, and are we being polarized as a race and make us feel inferior and dealing with our psyche? Who is coming up with all those facts? I believe in research, but at the same time, I'm saying, is it true? Because they have been telling us so many lies in the past. So why everything negative seems to be hanging on Black people?
Well, I mean, you have to ask yourself, why would they do that? Why would they show negative numbers for the Black people? What is that going to do? Like, how does that? I'm trying to see what they would accomplish by doing that. I think the facts are the facts, and I see it in my practice every day. I see the negative outcomes in our community. It doesn't take research for me to see where the dialysis clinics are in our city. If you look at who are getting the amputations from diabetes, if you look at the numbers of the heart attacks and strokes proportionately in our community, those numbers show you that the facts are the facts. I don't think that research, now what has not been done in the past is an effort to correct the disparity in those numbers. So now we're seeing more of a push in medicine to see how do we change the issues that are affecting these communities of color so disproportionately. COVID was a big spotlight on the already poor health in communities of color, because you saw the disproportionate deaths in communities of color. And it's all because there was already existing uncontrolled medical problems. So you add a deadly virus on top of unhealthy people, they are going to die and suffer more. So the facts are the facts. We see it in the numbers, we see it happening. So what are we going to do now that we see that we are being greatly affected? So I don't think it's an effort to shame or disgrace us. I think it is what it is. And even if you have any doubt that those numbers are wrong, look at COVID. COVID ravaged our community, and people, white folks, Caucasians, they weren't affected proportionally as we were, Blacks and Hispanics. And that tells you something. That tells you about the health of our community.
So my question, my follow-up question would be, in your experience, do you think that human nature, as we see it, men versus white men, black men, do the level of mentality or the way of the thought? If men don't like going to the doctor, is it only black men, or do white men have this exhibit the same behavior, or is it just black men that don't like to go to doctors?
No, white men also are, they're not as keen to go to the doctor as white females. But what you have different, the difference between white men and black men is that number one, diet, exercise, obesity, those things in the African American and Hispanic community, you don't see that. So the majority of men of color are going to be unhealthy as far as their health practices. So that is a starting point. Secondly, white men are more prone to go to a doctor because they have more access to physicians. So there are a number of things that lend to the poor health in the Black community: diet, exercise, getting to doctor, having insurance. Those are all areas that white men have advantages over us, okay? When there is a correction for education, when you have Black people who are as educated, who have access to healthcare, who practice the same health practices as Caucasians, their rates of disease greatly improve. So part of the issue is the things that we don't do that they do. That makes sense?
Someone made a comment: poverty and lack of education plays a big role. Why Blacks at the top of every negative health index. I'll also say that many times Black people work jobs that do not offer health insurance.
Right.
And so that would contribute to that as well.
Right. Absolutely. They're not access to healthcare, or if they do have insurance, they can't afford the deductible, they can't afford the copays, they can't afford prescriptions. So you can be underinsured as well. So all those things go towards the negative impact of health on African Americans. So there's a lot of work going on right now for disparities in healthcare and trying to find ways to address that underbelly that's been exposed through COVID. So that's a good thing.
Well, we're going to.
Can I?
Go ahead.
Yeah. Hi, Alan. How are you?
Doing well.
I just wanted to find out. I just want to make an observation that when we, I think one of the things in the Black community that can be improved is when Black professional in the healthcare industry make it their business to go back into those community and try to educate the folks. Too many times when we get ahead, we we move away and we don't go back to our communities and try to educate and encourage and empower them to take better care of their health. I think if we're intentional about investing our time and our talents into the Black community, it will go a far way to significantly impact the health and well-being of our Black brothers and sisters.
Someone said, don't you think that universal health care can impact positively the health index of African men, especially in African American? Generally, countries with universal health care has better, according to the United Nations.
Okay, I have a problem typing this, so can I articulate it, please?
Go ahead.
Okay, yes. So Dr. Raynon Andrews, thank you very much. This is Earl Henry. I really enjoying and learning a lot. Don't you think that universal healthcare, as pushed by people like Bernie Sanders and AOC and referred to as social medicine, can impact positively the health indexes of African American men and specifically African Americans in general? Why? The United Nations report shows us that in countries where universal healthcare is delivered, they seem to have better delivery of healthcare than even this first world country, the richest country in the world, the United States. I would like to hear what is your opinion on universal healthcare, or which is called by the Republicans as social medicine.
Yeah. So I do feel that there's a lot of people who don't have access to healthcare, and I would be a proponent of everyone having something in order to be able to get just basic care. I think it's a right. I think it's kind of absurd to be the richest country and one of the richest countries in the world, and you can't take care of your people, or is that you don't care to. So Canada, they have universal health care, but you also have a system you can buy into. Your job can get you commercial insurance as well. So I don't see why there can't be a two-tiered system here in this country. I think it's a reluctance to take care of those who are just gaming the system, or they don't want to work and they just want benefits, that type of mentality. But COVID showed us that if we don't take care of those who are not caring for themselves, it is going to impact everyone. So wisdom would say, you know what? Let me take care of these people and give them some level of health care so that we don't get into this situation ever again. Even if it's selfish, but it shows that when you don't care for a certain population who is unable to care for themselves for whatever reason, everybody suffers because of it. So I do believe that it could be a way for minorities and those who don't earn incomes to afford insurance or health insurance could have a safety net to get a level of care, and it would definitely reduce the rates of diabetes complications, heart disease complications. The complications from diabetes, limb amputations from diabetes, is probably the biggest cost to our medical healthcare system.
Mercy.
It makes sense to say, let's eliminate that problem. It's the biggest cost to Medicare, is paying for complications of diabetes. Let's eliminate that problem by giving these people some preventative care, but they won't do it. They rather just pay for the problem instead of giving somebody something who didn't earn it or don't deserve it. And that's just the mentality of our legislators in this country, which is definitely on the wrong track. So I hope they can, maybe this administration is probably the best suited to address some of those challenges. But of course they're gone in a few years. So here we go, it just swings back and forth. So I would like to see some form of assistance for that population.
Dr. Andrews, can I make a comment?
Sure.
Yeah, well, the question was asked about universal health care. I live here in America. I don't live in those countries, but I have about 10 nephews and nieces who live in the United Kingdom, where they have that. I have 2 sisters in Canada who is exposed to that. And up until now, both of them are older than I am. They have not been vaccinated yet in Canada. And my nephews and nieces are telling me the same problem. You on a waiting list. And so the fact is, it is not all what it seems to be or what they are telling us.
Yeah, I do agree. There are challenges with universal health care. There's no debate about that. But I think that, like I said, you can have your commercial insurance and also some type of government insurance that can, and your commercial insurance can increase your access. You know, my friends in Canada who have healthcare, they say, yeah, you do have to wait if you're using the government's, but if I use my works insurance, I can go and get things done instead of waiting for my government insurance. But I think it would provide some level of care. I'm not saying it's perfect, but it would provide some level of care for those who right now have nothing. I mean, I would take some food instead of no food. You know, I'd probably take spoiled food instead of no food. So I think it would be a safety net for a population that right now is it's still costing us money because they're going to the emergency room and tax dollars we're having to pay for that. So it's still trickling down whether we like it or not.
Well, Dr. Andrews, are you still taking patients?
We are, yes, sir. We are.
Okay, and I know that you don't want to advertise, but if I don't know if you can put your information in the chat so that folks would have it available to them should someone need a doctor.
I am trying to find the chat, but I'll say it. Andrews Medical Care is our office at Gmail. Andrews Medical Care is our website. So you can find us there.
Okay, so we're going to, someone put some information in the chat where there's a website that you can open if anyone want to go ahead and do that. But we're going to bring this session to a close. I want to thank you, Dr. Andrews, for taking the time to bless us with the comments and with the knowledge that you've deposited upon us, and for encouraging us to take better care of our body temple and to have closure to go ahead and complete, you know, to take a greater interest in our health. You know, we can't just pray it away. We have to actually do something. We also have to be careful not to wait until, in some cases, until we start symptoms, because by that time it may be too late. So it is a good idea to continue to have the mindset to get you at least a physical once a year. And if you have a family history, you should really, really pay attention to that to make sure that you, you know, follow up on such things. We can't say, well, you know, nobody in my family have it, because you could be the first. So anyway, we thank you for all that you have said to us and for taking the time. So we're going to have prayer and conclude this presentation. Okay?
Sure.
Shall we do that? Heavenly Father, we just thank you. Thank you, Lord, that you bless individuals with the knowledge that they can be used by you to bless others, to help us to live better, meaningful lives. We ask that you would bless Dr. Andrews and his practice, and we ask that you would bless every individual that is on the line and their families, we pray. We thank you again for your blessings, your mercies. We ask these things in Jesus' name. Amen.
Amen. Amen. All right. Thank you.
Thank you.